Take a look at that face. With it being National Cat Health Month, we're checking out the internal medicine here at Ohio State's Veterinary Medical Center. And joining us is Dr. Quimby to see how they're caring for our feline friends. How are you doing, doctor?
Good, thank you very much.
Good, so who's with you right here?
Yeah, this is Sophie. She's an 18-year-old female ragdoll. She's actually my personal cat.
She is beautiful. Yeah. And I have to say, when you think of cats in the hospital, I've seen it before, usually they're stressed out. She is super calm.
Well,
why is that?
Yeah, she is actually, well, obviously she's older in her years, but this is different for her because when she was young, she was very stressed at coming into the vet. But just recently in the last year, we had a really exciting clinical trial in feline medicine, and it showed that there's a medication called gabapentin that's pretty safe, and you can give the cats before they come to the hospital.
Oh, wow.
And it just really helps them be calmer. So this is Sophie now.
Oh, she's doing great.
After 17 years of really being stressed, she comes with me all the time and does not mind if she needs to have her blood drawn or her blood pressure taken.
Now talk about what Sophie has, because there's a reason why she's come here.
Yes, yeah. So she does need to come in regularly because she has chronic kidney disease. So most older cats, and since she's 18, that definitely qualifies as older. She's had chronic kidney disease actually for about 5 years now, and one of the things that we've discovered, I really like this new medication, but when I first started giving it to her, we immediately discovered she needs a lower dose than other cats who would have normal kidneys. And so that's actually why participating in clinical trials is really important. So from that information, we now have a new clinical trial funded by the Win Feline Foundation to look at how best to give that medication to cats with chronic kidney disease.
And what are some of those clinical trials that are being done here?
Yeah, we have several clinical trials specifically for kidney disease and also for cats. We have a trial looking at giving an appetite stimulant to help them with their appetite. Also an antacid medication, and then the gabapentin trial as well will be enrolling soon. We also have trials though for having bladder stones be removed with a diet, as well as for cats with heart disease. So there's actually a lot of clinical trials.
That's incredible, and I hear there are actually some going on right now.
Yes.
Can we go see them?
Yeah, you bet.
All right, let's pack you up, Sophie.
Come on, little girl.
We gotta move.
Here you go. So here we are in our feline ward. I'm just putting Sophie back in her cage. We like to give them
it's very calming in here, doctor.
Yes, yeah, we like to give them a place to hide. They have these nice new fancy cat condos, and they close quietly and have different spaces for them to hide. So it's all part of a calming experience for the cats, and it's part of our feline-friendly hospital initiative to help them out.
And I see your team over here working on a cat. What are some of the signs that cat parents or pet parents should look for that they really need to then know to bring them in?
Yeah, so Shiva is one of our kitties with chronic kidney disease who's come in to see if she can be enrolled in a clinical trial, and what her owners noticed was that she has not been eating as well. And so with kidney disease, we have things like they're drinking more water, they're urinating more, their appetite may not be great, and they can lose weight as a result of that.
Very similar to even humans.
Yes.
A lot of things they face, so a lot of the similarities between the two to look for.
Right, exactly, and so that's a lot of what we do with the clinical trial is we might have seen a medication that's actually helped people out, and now Shiva is going to participate in the appetite study, see if we can help her with her appetite.
That's great. Now I do want you to brag on your team a little bit. We have Jess and Jess with us over here. Talk about the team that works here.
Yeah, absolutely. So these ladies are a big part of helping us out with working with the cats in a non-stressful way and making sure that we can get a blood pressure. That's what they're about to do here for Shiva. Get our blood and urine samples drawn, and of course for these kitties we do have to do that pretty regularly to make sure that everything is okay with them. And so this little one, she's great actually. For coming in, she's all purrs. And again, you know, when they come in, we're looking at to see are they hydrated? We feel to make sure they're not getting too bony, and those are all things that owners, you know, should be thinking about. As a good pet parent, you know, you want to be aware of those really subtle things.
Absolutely.
Cats like to hide their diseases, so we want to make sure that we're keeping on top of things and doing the best job we can for them.
Nice. So for people watching, if they want to find out more about the diseases, and even have their pets participate in a clinical trial. Where can they go for more information?
Yeah, you bet. So the clinical trials office here at The Ohio State has a website that has all the information for clinical trials on it, and there's detailed information for each trial. Like I said, we have multiple trials for cats. We also have, there's quite a lot going on actually, so we have multiple trials for dogs with kidney disease as well. And that's actually part of why I moved here to this university, is that we have a fairly big cross-disciplinary team for kidney disease.
That's great.
And all of that is potentially going to help our patients in the end. So
there we go. Well, you did a great job, or should we say a perfect job. For all the information you need, just visit the website. They can take care of your pet here at the Veterinary Medical Center on Ohio State University's campus. Doctor, thank you. Jess and Jess, I can help you out too. There we go. You're doing a great job. You're doing great.